Hi, this is pharmacist Curtis Alexander. In this video, I want to cover the medication. This is part of my 101 series, but cover the medication Meclizine, which is also in the active ingredient in the over-the-counter medication Dramamine, which you see used for motion sickness, those sorts of things. So just hopping right into it, I kind of mentioned that it can be used for dizziness, motion sickness, the nausea and vomiting associated with that. As far as dosages, you're going to generally see Meclizine from the 25 milligrams a day to 100 milligrams a day, depending on what you're using it for. For motion sickness, it'll probably be 25 to 50 milligrams. I'd probably do it a half hour to an hour before travel. And then for vertigo or the dizziness, it's 25 to 100 milligrams a day, and you usually divide the dose out. Now, one of the big things, Meclizine is an antihistamine, and histamine, when it is circulating around in your body, has a lot of effects. So by inhibiting that, you also are going to get some effects, including side effects. So one of the things you'll see with something like Meclizine is you'll be blocking constriction in the body. You will also be blocking what's called acetylcholine. Acetylcholine has effects particularly in your parasympathetic nervous system, so your digestive tract, your awakeness, those sorts of things. So we'll get into the side effects, but that's where it's coming from, because you're blocking histamine during this process. Okay, I mentioned if you take a dose, you're going to start seeing it work 30 to 60 minutes. You'll start feeling effects. It can last anywhere from 6 hours to 12 to 24 hours, and that's basically dependent on the patient, but also very dependent on the dose you take. At the lower end of the dose, you're going to get 6 hours. Higher doses, it's going to last longer. That's why some people, they'll take it more towards the evening. If it's a higher dose, they'll wake up kind of groggy, almost doped up a little bit because they took a fairly high dose. Okay. All right. So some cautions, side effects, people I would be careful with. One of which is an aspirin allergy. Some of the the Meclizine formulations can contain an ingredient that people with an aspirin allergy can have a tough time to, so be careful on that one. We also want to watch its use if you have asthma or emphysema, bronchitis, so a lot of respiratory lung things going on. Also, glaucoma is something to be careful of. All right, the other area I would be careful with, and we'll get into why here in a second, but you don't want to drink with it, okay? And the other thing is you don't want to use any other sedatives with it. We already went over the fact that one of the big side effects is drowsiness, the grogginess. Those sorts of things are going to compound it, so you do not want to use alcohol or other sedatives. Again, we mentioned drowsiness is a main side effect. And there's some other side effects that you need to be aware of. You can see vision changes, blurred vision. Again, now we're going to get into some of those, the acetylcholine that it blocks. When you block that, you can get dry mouth, you can get a decrease in blood pressure, and then again, you're getting dry nose and throat. Now, that's kind of Meclizine in a nutshell. It's a useful medication. The one thing I would mention is I sometimes get people that tell me that they're using it for sleep. Not a good thing to be doing. I don't like any of the antihistamines to be used for sleep, quite frankly, but especially Meclizine, don't want to be doing that. So if you've used Meclizine, I'd be curious to know your experiences. Post it in the comments. It's always helpful for me. It's helpful for other viewers to know your experiences. And if you have any other video ideas that you'd like me to cover, post them there as well. So I hope this quick overview was helpful for you. And until the next video, thank you.